Campbell. I'm a patient at UCLH. I have 6 LSS, and for the majority of my life, up until recently when I started on the exchange program, I spent most of my life in hospital. And at one point, I was spending on average, say, 8 to 9 months a year as an inpatient, um, culminating in a few years ago where I actually spent 2 years, 8 months, and 2 years as an inpatient without leave. Had a severe crisis and leg ulcers, 6 leg ulcers at the time. Um, so I had ulcers from both legs just below the knee, and it looked as if my legs had been dipped in sulfuric acid. I have severe sickle cell, so I'm in pain all the time. I take morphine for, and it's impacted on my life quite significantly. Not just in the amount of time I spent in hospital, and some of the issues I've had to deal with, illnesses and whatever, but also how it impacts on my family. I have 2 children, a boy and a girl, and 4 grandchildren. And my daughter, up until she was about 7, didn't actually realize I lived with her because I spent so much time in hospital. And I wasn't aware of this until one day when I had a hospital appointment and she asked me if I was going home. So I confusedly said, what do you mean going home? So she explained. So then I had to explain to my daughter and to my son that no, I do live with you. I just spend a lot of time in hospital because she was used to seeing me more in hospital than out. They just assumed that I lived there. Um, and so I do bear a huge amount of guilt. I carry a lot of guilt with me and how it's impacted on them and others because they had no choice. And the fact that it affected them to the point where, I would see distress in their eyes every time I left the house because they were unsure whether or not I would come home. So I have 2 bracelets, one on each arm, which I would have to give one to my son and one to my daughter and ask them to look after it for me until I got back home again. So it's impacted me greatly. The exchange program has significantly changed my life in a way that's undescribable to how my life was before, where being at home for maybe a month at a time was a treat almost. I spent so much time in hospital and have done through most of my life growing up. Went to Great Ormond Street as a child and used to just make excuses to children at school as to why I was never there. I went on holiday, I was away because all my parents' job changed, so I had to move for a while and things like that. So I do feel guilty in that respect. And the exchange program has enabled me to do things that I would never have dreamt possible to do before, like traveling for the first time. I'm also a member of the Positive Choir. I'm a tenor, and you may have seen some Britain's Got Talent and other places. And in the last few years, I've managed to travel to Boston, performed in Vegas and Denmark, which is something that I never thought I would do. Not just traveling, because one, I could never get insurance travel, and two, I was just never out of hospital long enough to be able to do any of those things. So how it impacts your life is significant. It's not just the pain; it's the emotional toll it takes on yourself and others. I, I deal with it how I deal with it because it's all I know. But how others have to deal with it and the impact it has on them has a bearing on what I do and how I think. So, I often wouldn't go into hospital even when I needed to because I thought more about how it would impact my family having me in hospital again. So I would just swallow an inordinate amount of morphine and do anything really to stay out of hospital, just so I could give them some kind of normality, which I've been able to do for quite a few years now. And it's been a few years since I've been an inpatient. So I do spend most of my time now, all of my time, trying to improve the lives of people with sickle cell thalassemia and get greater health equality. I'm a chair of a charity called Red Cells Are Us. I sit on the board of HCC, and I also work for NHS Plasma Transplant as well as singing for the choir. And I'm able to do things now that I would never imagine myself doing 10, 20 years ago. To be honest, 10, 20 years ago, I wouldn't have imagined myself still being here, to be honest. I spent that much time in hospital and had so many health issues, some which I still have, but I deal with them better now because I have a degree of stability in my life, which I didn't have before. So, yeah. So feel free to ask anything you want.
How would you like people to ask you, Calvin? Do you want them just to speak out?
Yes, if possible. Sorry about that. My grandson.
Is that your grandson?
Yeah. Big time.
It's like the BBC News thing all over again when he's the kid.
Yeah. Hold on 1 second. I shall pass him over to his grandmother. Hold on.
Oh, sorry about that. 1 minute.
My apologies. Yeah, sorry.
That's cute.
See, things like that where having grandchildren. Like I said, years ago, I would never imagine myself being there and being able to have grandchildren. So having grandchildren is the best thing in the world. And despite all the things I've managed to achieve, those are my best by far. And bring more joy to me than you could possibly imagine. I have to be honest. I love kids and I love having them around, even when I'm doing Zoom calls, which he often turns up. He sat on more Teams calls with me than most people.
Okay, guys, is someone gonna throw off the Q&A bit? So anyone just unmute yourself, ask any questions you want. It's what you make of it. We have the expert here.
Hiya, my name's Harriet. I work
Hi, how are you?
in the Whittington ED. It's nice to meet you. I was wondering, what was your pivotal moment where things changed? Do you think it was your treatment that then changed and sort of moved you forward, or do you think it was a bit of your mind, body, and treatment all at once?
I'd say definitely treatment. Because in terms of how I deal with it, so mentally, it's, to be honest, it's never actually bothered me. I've never felt sorry for myself a single second day in my life, not once. I look at it, there's always someone worse off than you. When I'm well as I can be, I'm able to do what I do. When I'm not, I'm not. And it has never bothered me in that respect. So the treatment has definitely given me stability and evened out. So even when I was still going in that hospital, I was still spending more time at home than I was in hospital. So it allows you to have normality and think in the way everybody else does, rather than thinking of snatching moments. I was able to plan things and say, okay, I want to do this, and actually think, yeah, I'm able to do it.
And then I suppose when you went into hospital,
yeah,
how, I suppose from your perspective, how did that feel? And not just how it felt, like what would you change about that whole journey from the front door to being obviously admitted?
Starting with A&E, definitely change A&E, and how it's hard to describe someone. Sickle cell is the most painful illness on earth. It's pain beyond belief. And whereas most pain I've seen have a cutoff point, sickle cell does not. No matter how much medication you give me, it never ever takes the pain away. It takes the edge off. And so if you arrive at A&E and someone then asks you to take a seat, seen by a nurse, take a seat, seen by a doctor, take a seat, and you're in excruciating pain, and all you want is pain relief or someone to give you pain relief and basically give you a bed to lie down in. It's a strange thing to see someone think of you as a junkie, that you're only there for the medication, and you get that. And I can see bad doctor or nurse all coming before they've opened their mouth, and I know exactly what you're thinking. So I always think to myself, you should treat people the way you want to be treated and the way you expect your loved ones to be treated. I'm there because I have to be there, not because I want to be there.
Yeah.
So patients don't come into hospital because we think, oh, it's a great time, you know, we get to lie around in bed and get morphine. No, I'm there because I have to be there. I have no choice. I'm in pain that you couldn't possibly imagine, plus all the other things that happen to us. So treating people as human, having some respect for people in the way you approach them, the way you talk to them. You know, you sometimes get this thing where people with sickle cell have an attitude. And I often say to people, you ever ask a patient why it is they may seem a bit tense or irritable? Remember, you're talking to someone who's in pain that you couldn't possibly imagine, and then having to deal with someone treating them as less than, treating as if they're there just for the drugs, then moving them around, going from one place to another, and then when you get to the ward, having staff that don't understand what it's like. And you know, the dumbest question I've ever asked is, are you pot watching? Of course I am. Because if I know that you're going to give me pain relief every 2 hours, I'm going to ask you every 2 hours. Why wouldn't I watch the clock? I'm not going to sit there in pain and not ask you because I'm afraid that you may think less of me. You know,
Yeah.
so I would just remind people to treat people as you want to be treated. You know, we're human beings and we're in a lot of pain. Sickle cell pain is at its worst. It's like having every bone in your body broken with a baseball bat. And then someone repeatedly hitting you with that bat. Then sticking a hot poker through the bat, right out into your chest, then telling you to get up and do a marathon. That's what sickle cell pain is like. And for us to then sit there and then have to be pleasant to someone and have to be polite and have to answer some of the most ridiculous questions repeatedly over and over and over again and stay calm. Sometimes people will get irritable. And I just think it behooves the person asking the question to be understanding of that and to think, okay, what would I be like in their position? You've seen someone come into A&E, whatever, with a broken leg and seen how much they scream. You're compassionate to them because you can relate to it. For whatever reason, you're unable to relate to sickle cell pain. You know, you get someone saying, oh, you don't look sick. What does sick look like? Please explain that to me. I want to find sick in a dictionary and find a picture where it says, oh, this is a definition of a sick person, but this isn't.
Thank you. Thank you.
You're welcome.
So there's a couple of things that have come through in the question, in the chat.
Yeah.
At what age did you start realizing the weight of your condition?
Mine kicked in really early at 6 months old. So from 6 months old, I was hospitalized with crisis. And I, whatever reason, realized quite early that it made me slightly different from the other children, and I was treated differently. Growing up and going to GOS, the treatment back then was not great. It wasn't great at all. I mean, even with some of the problems now, this is, you know, heaven compared to what it was then. So, and we weren't given the large doses of opiates. Most I was given was paracetamol. We weren't given blood regularly. And we're often just left in pain without any treatment and separated from the other kids. So when I was going to hospital, at POS, there was a waiting room where it's a long corridor. And I would be left there sometimes 6, 7 hours, just me and my mother, waiting for just before we brought onto the ward. And once brought onto the ward, the senior doctor prods and pokes you, and maybe gives you diazepam or something like that. And I didn't even know anything like pethidine or morphine existed until I transferred over to UCA. And that was the strongest painkiller you were ever given. And you were often left by yourself. So you quickly realized that there's something different about you and how people view you. because you see all the other children playing and being attended to by the nurses and doctors and spoken to in a way that you weren't often spoken to, treated in a way that you weren't often treated. And if I'm being honest, then if you add racing on it, wasn't pleasant half the time. I have a scar, well, a big scar around there, and I got osteomyelitis about 9 or 10 maybe, and I needed an operation to sort it out. When I went into surgery, I had 3 meds, and when the doctor began to cut into my arm, I told him I could feel it. And he said to me, "Oh, don't be sick. You can feel it." He then proceeded, carried on. And I said, "That really hurt. What's that effect?" So he got 2 nurses to hold me down. And once he cut into my arm, they took a drill and drilled into my arm for approximately 3 hours. Whilst 4 other nurses held me down. I refused to make a sound, not once. Didn't cry, not once. And whilst they did that, they called me every racist name under the sun. Then stitched up my arm, brought me back to the ward. That wasn't unusual, how you're treated. And it goes back to the point I made earlier. If you think of a group of patients or people as less than, it allows you and it gives you the ability to do things that you know you shouldn't be doing and you would not normally do to other people. It allows you to have no empathy, have no care for how that person feels or what you do to that person. Someone once asked me, did I make a complaint? No. Who was I going to complain to? And why would I complain? And who were they going to believe? Me or this surgeon that everybody called Mr. But it goes back to my point. If you don't have empathy and you don't think of a group of patients as equal, as worthy, it gives you the ability to do things that you shouldn't do and you know are wrong, but you'll do anyway. And other people who watch and stand by and allow you to do those things are equally as guilty because they know it's wrong. So compared to now, whenever I hear of someone having a bad time in hospital or being mistreated, I say it's not just the people doing the mistreating, it's those that watch and stand by and allow that to happen. Because if you didn't allow it to happen, it wouldn't happen.
Wow, that's very powerful. I just can't believe that happened to you.
Yep, did. Nearly 4 hours. Took a drill to my arm, drilled through both sides, then stitched me up.
Christ. There's another one, Calvin, saying, what advice would you give to children and young people with sickle?
Learn as much as you can about your condition. Knowledge is always power. The more you know about yourself and how this condition affects you, the more you can help your treatment. So if you know as much as you can about your condition and how it affects you and your limits and what you should and shouldn't do and how best to manage yourself in the cold and how to manage yourself in summer when it gets too hot, you then have a better understanding of what treatment perhaps shouldn't or shouldn't be done, or medication. So you may question someone giving you something and you say, you don't know, you won't question it. But if you know, you may question that. Just having knowledge of yourself and your treatment and how your body works, what works best for you, and the best way to keep yourself as healthy as possible is absolutely your best gift. Because I decided from very early on to learn as much as I could about sickle cell and thalassemia, and to learn not just the genetics, the mechanics of it, and what treatments are best, and what should and shouldn't be done. Keep up with research, see how other patients are treated, and see how they deal with certain things. Pain management, it's opiates aren't going to take away your pain. Nothing's going to do that. But you can help the opiates by, say, using other ways. So, distraction therapy. I'm a big gamer, so I like playing computer games and PC games. So days when the pain is at a higher level, and I know that just taking more medication or more morphine is not going to work, and I don't particularly want to come in hospital. Again, I do whatever I can to distract myself. I'll read, I'll watch a movie. I'm a musician, so I write and I play. I'm lucky enough to sing in a choir that is particularly busy. So I do all those things to like adding to your armory, adding to your ability to deal with it. So if I'm going out in like a cold day, I've got long johns on. I'm not embarrassed because it keeps me warm. It'll stop me from having a crisis. I don't care what other people think. It's how it affects me. In summer, I drink a lot all year round. But in summer, I double that. I make sure I'm always well hydrated. I'm not going to go sit in a park and sit in the sun and roast and get really dehydrated and then wonder why I've ended up in casualty last day. Things like that. If you understand things like that and you think about how it affects you, then you're better able to look after yourself and manage your own condition as well as the physicians. And you almost end up working like a team rather than just being someone sitting there and being told, do this, take that. You're able to help and work. It's just a better way of looking after yourself. So find out as much as you can about your condition. Perhaps join a support group in your area, and help others. Because I'm often surprised that the number of people with sickle that don't know anything about their condition or as much as they should. I'm speaking to male sickle cell patients where they describe something, and I said that's a crisis, and they said what's that, and they're not aware of what that is. And just things like that. So if you can empower yourself with knowledge and then help others as well, you've got a stronger basis and some way to focus the pain, because pain makes you irritable. Pain changes you. Pain makes you react in a way that you don't necessarily want to react, that's not necessarily you. Pain makes you angry. I'm being honest. I've been angry since the day I was born. I took up martial arts and kickboxing and boxing when I was 11, just as a way to vent that anger. Because taking it out on people that don't deserve it is not the way to live your life. And walking and being angry all the time is tiresome. So you have to deal with it. So you use that as another tool in your armory. That anger you feel, that irritation you feel, the fact that why is this happening to me? Why am I always in pain? Why does this not work? Why am I having this problem? Why, I've lost my eyesight. I've been paralyzed from there down, from the chest down. I've been blind. I went blind at school, secondary school or primary school. Literally looking out the window one day, turned around, looked that way, looked back at the blackboard, didn't see anything, nothing for 3 years, not a thing. And it was so sudden. It was just like, didn't have something, it just happened. Now, no one explained to me at the time what happened or why it happened. I had to find that out for myself. But I didn't allow that to weigh me down and burden me. I'm a glass half full. Look at the world as a glass half full, and there's always somebody worse off than you. And the only way you can function and deal with your condition is to have as positive an outlook on life as possible. Don't think of what you're missing and what you can't do. Think of the things that you can do and that you will do when you're able to do them. That's how I deal with being in hospital for years on end. You know, I didn't sit there thinking, woe is me. I just sat there every day and thought about all the things that I'm going to do the second I'm out, and then tick every single one of them off my list. I said, my bucket list is pretty good.
Crazy. Anyone want to ask any other questions or find out more about stuff? Don't be shy.
You ask me anything, I don't bite.
Hi, Calvin. My name's Catherine.
Okay.
Hi, I'm a nurse at UCH, and I suppose on a really practical question, although first I really want to just like validate your story and just say it's been pretty horrific to hear how you've been treated, and I'm really sorry that that happened to you. So on a like more practical nursey thing, I guess, is we have to go to a patient every time and say, what's your pain scale? And I always feel a bit silly doing that to a patient in a sickle cell crisis, because obviously they're in pain. Is there any way I can like have this conversation without cringing inwardly at the fact that I have to document this on the chart, you know, the pain scale and why I'm giving them morphine or, you know, subcut morphine or something like that? That's, you know, okay for you guys.
Yeah, humor. If you approach it as if you're speaking to one of your friends, just have a conversation, just, you know, how are you feeling today? And what's your pain scale at? What's your pain scale out of 10 today? Because I tend to measure it. Rather than, you know, you're just someone doing a job and it just says, what's your pain scale? And you're not even making eye contact. That is one of the most important things. When someone is talking to you, they're not making eye contact. They're thinking about 10 other things they're going to be doing that day. And they're not really attention. And you say whatever. I've done it. I've said a number. And the nurse said, okay. And I said, okay, so 50 is okay then. And it, so just to prove a point, because I know they're not paying any attention. So if you pay, you know, if people know that you're paying attention, like anybody in a conversation, and that it's coming from a place of care, then that makes, even if you've been asked the same question 10 times, it makes it easier to bear. And it doesn't actually bother you, because you know that person's asking for a good reason, that, and he or she is trying to help you. So you know that they're thinking, okay, this pays good. So then the next question would be, if you're giving whatever it is of morphine or whatever, you're asking them, you know, is that sufficient? Is that too much? Whatever. They have a choice in there, or an input into their pain management, rather than just saying to someone, yep, okay, you know, smile, sharp brick, that's it, and you're gone.
Thank you.
Welcome.
Just
after, oh, sorry.
No, you go. You can finish off.
I was just going to say, so I'm a pediatric nurse. So we try and involve the parents. In, because they know their kid better than we do. They know what's normal and what's not normal. I suppose from your experience being in hospital with your parents. I don't like to talk over a child or anything like that. You know, their experience is valid, and you need to, you know, if they're able to communicate that. But obviously the parent is the expert. Is there anything that you remember that you wish had maybe been done differently when you were a young child in hospital with the nurses, you monitoring that kind of thing?
Yeah, you hit the nail on the head. Don't talk over them. Talk to them. Because I hated that as a child, where, you know, they would have a conversation with my parents, mainly my mother, and I could have just gone off and disappeared, and no one would have noticed. It's like you feel invisible. You're the one going through this, and no one's actually bothering to ask, your opinion, ask you how you feel. Even like you said, the parents are the ones that know their child, but you still should involve the child. You still should ask them the questions, speak to them as if you're talking to them. Don't talk down to them. That's, it's not only rude and insulting, imagine you're a child and you're sitting there and you're in this pain that you don't always understand. You can understand someone talking down to you. You understand the fact that they're speaking to you and they don't really care what your opinion is. By the way, if you just talk to some, like I do my kids or grandkids, I talk to them. I don't talk down to them. I don't dumb it down, as it were. I'm going to phrase something in a way that, is age related, appropriate, but I don't dumb it down. So I ask them, how are you feeling? Where does it hurt? Does it hurt more here? Does it hurt when I do this? And you often find that they engage and they give you information that the parents aren't able to give, and in a way that is beneficial to how you can best judge their pain and where it's coming from and what parts of the body hurts more.
Thank you.
Welcome.
So I just wanted to ask you, Calvin, about obviously you said exchanges have changed, is a game changer for you. It's improved things incredibly much so. Before that, what did you have? Did you ever have top up transfusions? Did you have hydroxycarbamides?
So prior to that, I would just have regular transfusions. So I have massive iron overload because of years of just having 3 to 5 units every week, literally. And as much as that helped, it didn't stabilize me in the way the exchange program has. I was still spending lots of time in and out of hospital, and then you run in, because of having to have blood so often, you run into the inevitable issue of finding places to stick a needle. And so making the whole experience of going to hospital made it even harder. So, I was one that you'd have to drag me into hospital. You'd have to literally it would be the last resort, and often made things worse for me because I was only hurting myself by refusing to go in, even when I was really unwell. I remember I had a gallbladder removed several years ago, and I only went in because I was actually doing some jiu-jitsu, and someone kicked me in the side, and I went down to my knees and just puked up. I was just I couldn't believe how much pain I was in. And my partner said to me, "You're going to the hospital because you've been in pain for a while." I went to the hospital and probably remembers it, and he just was like, couldn't believe it. Said to me, "Did you not notice the lump in your side?" Yeah. Did it not hurt? Well, yeah. My attitude was that I don't care how much it hurt. It was the last place I wanted to be in hospital. And I had it taken, my gallbladder taken out, I think 3 days later. It was literally poking out through my ribs. So even though I had been regular transfusion, didn't change my life in the way the exchanges did. Exchanges literally was like a light switch going on. Literally, it was just like a light switch going on. Where, I remember once I was at home and I was thinking about how long I'd been out, and I was like, "Ow!" It was months. I was actually home for months. I think it was like 4 or 5 months at the time. I had never been home 4 or 5 months in a row. It was unheard of. And it was like almost hard to get your head around. Like, wow. And you get to the point where going into hospital becomes unusual rather than the norm, which is how it should be. So yeah, it affected my life a lot. And hydroxyurea I didn't take. I used to have to take Desperol to get rid of the iron overload and have to come in and be on a drip. I hated it. So I would literally disconnect myself, go home. I would discharge myself from hospital. Even in the crisis, I was just so sick of being in hospital. And it doesn't matter how much pain, I would literally discharge myself and go home. And there are an awful lot of nurses that still work at UCH. But remember me, just, you know, calling me up, where are you? I'm at home. Just didn't want to be in hospital anymore. And you can't explain that to people, the fact that, and that's why how you're treated when you come in, especially through A&E, irritates you even more. Because if you sit and say to yourself, if they knew just how much I hated being there, how much I didn't want to be there, rather than looking at you thinking, they're here again and they're only here for the drugs. Service simple online. I don't drink or do drugs. I'm a teetotaler. So coming into hospital and thinking I'm going to sit here on morphine getting high, not happening.
Awesome. So saying to the others, with the exchanges, it's great. It's a really good treatment for those who can access it.
Yeah.
But there's limited capacity and there's a waiting list. And it can take, I don't know how long you were on the waiting list, Calvin, before you got on it.
I was lucky because I was one of the original guinea pigs to try the exchange program because I've been on transfusion so long. And so when UCH started introducing exchanges, and they needed someone with good veins, and I happened to have good veins at the back of my arm at the time. So they asked if I wanted to try it out. Thought it was odd at first, but then once we sort of settled into a routine where they decided how often I would have it and how much, and it became a regular thing. And I saw the benefits of it quite quickly, actually. It was like, wow, where's this been all my life type thing? And it really, I explain to people how important, part of my job for NHS is to recruit blood donors. And I use myself as an example whenever I talk to people. And I say to them, you can't believe how much of a difference that makes from going to a place where you're spending literally on average 8 to 9 months a year, each and every single year of your life as an inpatient, to that being reversed, where I haven't been an inpatient for good 7 years maybe. I'm close a few times, got to A&E, back out again. Because and that's another thing it helped with, that even though I'm still always in pain, it's the amount of pain that I'm in on a day-to-day basis that seems to have changed, and that I'm better able to deal with. And then having that stability and that sense of normality also helps your mindset and how you view things, and it gives you, it bolsters that inner strength that most sicklers need just to be us, really.
And with your exchanges, Calvin, do you know what your normal pre-exchange S percentage is and post? Like, what's our target for you?
Target post is 20%, I think it is.
Yeah, it's about right for that's average.
And so usually by the time I'm ready for an exchange, which I have one tomorrow, it's usually up around high 30s, mid 40s, occasionally higher. Right now I have quite a spongy bone marrow, so it's spring back quite quickly. So which is why I have so much and so often. And then also they do depletions as well. But yeah, you can usually tell because within sort of the 2.5 3 week mark, your energy levels dip. I can always tell because just the sheer amount of morphine that I'm having or perhaps contemplating taking goes up. Yeah, so it's almost like your built-in calendar where it's that pronounced and how it affects you.
Okay. Does anyone have any other questions or anything I'd like to ask Calvin whilst he's with us?
And yes, the choir is available for booking.
I showed them a video of the Britain's Got Talent audition earlier.
Okay.
Were you on that stage?
Yeah, I was.
I'll have to look through. Yeah, what was your hair like back?
Yeah, so I had no hair. And sort of little triangle tuft of hair in the middle. So if you look at any video or performances, I'm literally the one in the middle at the front.
I have to look for a few now to find you.
So, original talent, Mobos, All for the Queen, sung in Vegas. Yeah, pretty good.
Awesome. Well, I think everyone's asked what they'd like to. Last minute chance, everyone.
Everyone's lost their tongues. You watch, I'll go and they'll think of questions they want to ask me.
Everyone's saying thank you in the comments, and they're very touched by your story and the time you've given us.
And thank you all for having me. It really is an honor. I'd like to add one thing.
Yeah.
Despite some of the mistreatment I've had, and some of the things I explained earlier aren't even the worst things that I've had. Really, honestly, aren't. Not even the worst. I don't blame the entire NHS. I blame individuals for what they do. And it goes back to what I said before about people being responsible. Individuals are responsible for what they do. I work for the NHS. I'm proud to work for the NHS. So I don't hold NHS or everyone responsible for the misdeeds of others. I hold them responsible. So allowing me to come in and speak to you today is both an honor and a pleasure. Thank you.
Thank you so much, Calvin, for your time and the stories. It's been really touching.
Well,
Thank you very much. Thank you.
well, thank you.
Okay. Right.